All right, for this routine, I'm going to be doing the anterior forearm. So I'm going to be working on the flexors. Remember, when you're gauging this anterior posterior, you're doing it with them in anatomical position. So palms facing up and hands open and hands out. All right, so this is a routine that I'll use for golfer's elbow, tennis elbow, and definitely it'll be in a routine to be treating carpal tunnel syndrome as well, as we'll get down into the palmar aspect of this. So we're going to be working on, again, brachioradialis. We're going to be working on the extensor and the flexor carpi ulnaris. We're going to be working on the long, nice long brachioradialis, muscle that runs up the top, and that's a big expansion. If I put my client's hand palm down and I ask her to try to rotate her hand back up, but I gently resist it, a little more pressure, you'll notice that muscle pops up and it's a nice big expansion. That's what we're going to be treating. All right. So when we're working on the anterior forearm, there's a couple of precautions that you have to worry about hitting as you're going through them and working on the flexors. You have to worry about the radial artery as well as the median nerve that runs right down through this canal. So both the radial, which is on the thumb side, since we'll be working on brachioradialis, and the median nerve is what you're going to want to avoid. So in this position, when we work, instead of having the arm fully supinated, we're going to put it into semi-supination so that brachioradialis is superior and sitting on top. All right. So with this one, again, you're going to get, it's a nice big expansion. So you're going to want to do a manipulate and compress. And then after you do your M&C, manipulate and compress it, then you're going to glide. If you have clients that have big arms, big brachioradialis, or if it's very pronounced, you may get away with doing a rotation with the hand where you actually glide it using the forearm or the knife hand side, heel of your actual palm. Right? Similar to the displacement with the bicep and gliding is the same thing that we're going to do here. We're going to displace on this routine. We're going to go in and displace brachioradialis and extensor carpi muscle, and we're going to laterally glide. So here they are. So I'm going to come here. I'm going to grab brachioradialis and I'm going to displace it immediately, and I'm going to go and glide up. And don't go past the thumb. If you need to, get another grip and then go up. Then I'm going to do it laterally. I'm going to pull it to the side and it's semi-supinated. Pull it and go deep and deep and deep. Glide up. Pay full attention to the full expansion of it. Right next to it is extensor carpi. So you're going to want to get that radialis as well. Remember, everything is radialis is on the thumb side. And next step that I'm going to do after displacing and gliding, I'm going to go and do a combination. And I'm going to do all of the flexor group, the entire flexor group. So you can glide that with the palm or with the forearm. And just make sure you're getting it semi-supinated so that you can get brachioradialis. And I change my hand position just so that you can see alternate methods of addressing the muscle. Okay, strum pronators teres. Okay, so as you get up here, pronators teres is coming right in through the elbow. So as you strum that one, medial to lateral. And then come down into the hand and work in the medial epicondyle and work deep into the palm of the hand. I also give a little oppositional stretch and opening it up a little bit. And that is how we do anterior forearm, the flexors. Very, very simple routine.